So when it now comes to the second of the questions, which is speed of recovery, I would say, well, that is partially a result of the speed and precision that you have had during the surgery. Because if you, as we said before, don't detach the muscles and the patient is able to use them directly after the surgery, he can walk in no time. Sometimes, if we treat patients with not osteoarthritis but neck fractures, mostly elderly people with a little bit of a demential disease, they sometimes don't even realize that they've had a hip replacement. Because at that age group you don't tend to try to fix the fracture, you rather go for a primary hip replacement. So and this is what we then do. These patients tend to stand up and forget about their treatments, because it's that less invasive that they don't feel there has been major damage apart from their fall and the fracture that resulted. And the only thing they feel is that they had a bruised hip, which they had obviously due to the fracture before. So you see, it's not really the surgery now that makes the difference anymore. For this subgroup of patients that I've just described, it's basically less pain due to the release of the hematoma they've had. It's less pain after the surgery than before. For the normal osteoarthritic patient, I would assume that these patients come to see some surgeon to get their hips done because they are suffering from pain. And sometimes when it's really severe and they describe their pain level on a vast visual analog scale from 1 till 10, whereas 1 is nothing and 10 is the worst you could ever imagine, they describe their pain as 7 or 8. And even if they are at complete rest, sometimes the pain is described as being 2 or 3. So this is what we are aiming for after the surgery. Actually, we don't plan to over-narcotize them and give them lots of pharmaceuticals to bring down their pain level to 0. Because these pharmaceuticals also come with side effects, and we want to keep them as low as we can. But these patients are quite adapted to that pain level of 2 or 3. So this is what we give them at the end of the surgery, and we just exchange the arthritic pain into post-surgical pain. So obviously after such an intervention the osteoarthritis is gone, but the patients suffer a little bit from post-operative pain. But if you keep it to a level the patient is used to, they walk without any problem. And this is what we try to achieve. And we achieve that with this specific technique in 80% of the cases. So 80% of these patients can walk after such an intervention with literally no more pain than they've had before.